Welcome, friends. Welcome to another edition of Freeing the Body, Freeing the Soul. I'm your host, Dr. David, the Cutting Edge Doc, and here on Freeing the Body, Freeing the Soul, we do in-depth interviews with individuals that are doing cutting-edge work in the areas of healing or spirituality or social transformation. And I'm very especially excited about today's show. I feel a little bit like a kid in a candy store. We're going to be talking with one of the world's leading experts on stem cell therapy, and named Kristin Comella. And my interests in this conversation come from many places. I'm interested as a clinician. I'm interested as a scientist. I'm interested as a futurist. I'm interested as a family member of someone who I believe can benefit from this. I'm interested in it from the point of view of studying innovation, about how we get a valuable invention adopted as a new practice by a community. There's so many things I'm interested in, but without any further ado, let me introduce you to Dr. Kristin Comella. How would you like me to call you in this interview?
Yes, you can call me Kristin. It's okay.
Okay, Kristin. Right. You can call me Dr. David. Okay. So Kristin Comella is a woman who has a PhD in her own right, and I'll sure that'll come up when she tells her story. And she is, from what I can tell, completely committed, both personally and professionally, to do everything within her power to disseminate responsibly and powerfully this innovation that we will label stem cell therapy. And I was first exposed to it in a big way about a year ago when I saw the 9-part documentary on it. Kristin, what was the name of that?
The Healing Miracle.
The Healing Miracle. Okay. And I immediately realized that this was a total game changer. And like all total game changers, are very exciting and also very challenging to get that innovation into the world. And I realized that, and then I had a lot of questions, like, for example, in that 9-part documentary, they talked about some people believing that the Holy Grail is stem cells from fat. Some people think it's bone marrow. Some people think it's placenta. There were pros and cons. Some people swore one, some people swore the other. So that told me that the science is probably still in its infancy, kind of like nutrition. But anyway, it really piqued my interest. And then people started talking about this other thing called PRP, and I wanted to know what that is and how that fit into stem cells, and when you do one and when you do the other, when you do both. I was interested in the economics of it, because insurance isn't paying for it, what we can do about that. So there's so many things, but I'm so excited to meet someone who is such an expert in the field and is so passionate about what she's about and walks her talk. She regularly, periodically does stem cell injections for herself. So I've got a lot of questions, but before we get into that, I want to give Kristin as much time as she would like to frame the conversation and personalize it by sharing as much as she would like to about her personal journey and kind of how she got to this point in her life. So I'm going to turn the show over to Kristin for a little while.
Thank you so much. Appreciate the opportunity to be here and to share everything that we've learned over the past 2 decades with regards to regenerative medicine with your audience. And my understanding is it's a very savvy audience, and they understand kind of the concept of achieving health, maybe from the inside out, and that this really is a combination of the physiological side, the mental side, and that all of these things play together. And, one of the things that you said is, this kind of battle, fat versus bone marrow versus platelet-rich plasma. And my feeling is the goal is always, we want people to feel good. And there's more than one way from point A to point B being we want people to feel good. And it's not one size fits all. And so we have to, in medicine, allow ourselves to be open to different pathways. You gave an example of diet, and what works for one person with regards to their diet may not work for the next. So allowing this flexibility in the medical space is key. So my journey has been quite interesting, and because I've come into something very medical from a little bit of a different direction, I think that it gives me a unique perspective. So in college, I studied engineering. So my bachelor's and master's are in chemical engineering. My master's from Ohio State University, go Buckeyes. And actually, true story, I never once went to a football game when I was at Ohio State. And I realized that's sacrilegious for anyone who went to Ohio State, but I didn't do it. Anyway, so I did study chemical engineering, which meant that I spent a lot of days in the laboratory. And while I was there, I was looking at something called magnetic cell sorting. Magnetic cell sorting is where you use nanoparticle magnets and you can tag cells based on the proteins that they may express. And so this allowed us to separate and tag cells based on these protein expressions, and we could learn something about specific populations of cells. So in particular, I was working with a population of cells that expressed a protein called CD34, which we now know is something that is expressed on different types of stem cells. So very interesting. After I finished my master's, I had an opportunity to go to a startup company called Osiris Therapeutics. And this was originally founded with using the technology of Arnie Kaplan, who is really kind of coined as bringing forward this concept of the mesenchymal stem cell. And the project that I worked on at Osiris Therapeutics was for meniscal tears or knee issues, issues in the knee joint. So we were applying the bone marrow derived stem cells directly into the knee joint to see if we could regenerate cartilage. I worked for many years looking at models in animals to determine how these cells would affect that meniscus tissue or some of the cartilage tissue inside the knee joint. After that, I moved to New Orleans and I worked with Darwin Prokop, who is also credited with being one of the founders in this space with regards to mesenchymal stem cells. And I was at Tulane University, and we were focused on using the bone marrow cells for spinal cord injuries. It's quite amazing what the body can do. The body has a unique ability to regenerate itself when it's injured. And sometimes we don't regenerate all the way when we have either a degenerative disease or when we have an insult or an injury to the body that's so great. So the whole concept of regenerative medicine is to tap into this technology that magically exists inside of us and use it to its fullest potential. So we saw some amazing things using, again, bone marrow-derived stem cells for spinal cord injuries while I was at Tulane. After that, I had an opportunity to move to Florida, and I started working predominantly in cardiac indications, and more specifically using stem cells that can be obtained from muscle tissue and applying those directly to the heart, to the damaged heart muscle after you've had a heart attack. And for anyone who has either had a heart attack or someone in their family has heart attack, you know that this can be really devastating. The damage to the heart can be so great that you end up with congestive heart failure. And having congestive heart failure as a diagnosis is truly a death sentence. Even with modern medicine, we are not able to extend the lifespan of patients with congestive heart failure. And patients could be taking 5, 10, 15 pills a day, and they will still get declining heart function. My feeling is that this is really unacceptable and that we have to come up with new options for patients who are in these kind of situations. So by applying stem cells to the heart, we can potentially improve the functionality of that damaged muscle and see some amazing things. I've seen patients who really had no hope or future based on the rapid declining of their heart function and turn that around. So I think really one thing to think of with regenerative medicine is that we're offering new hope and things in medicine that we would have said were otherwise not possible. About 8 or so years ago, I guess time is flying, but we started looking at stem cells from the fat tissue. It turns out that the fat is one of the most plentiful sources of stem cells inside the body. And we can get about 500 times more stem cells from fat than what we can get from bone marrow. And we realized that this could be applied in many different indications. The idea being that anywhere that you have damaged tissue or that you have a lack of blood supply, you could help to stimulate that recovery, that repair, and or formation of new blood vessels just by applying stem cells. And so since that time, we've published more in the space of using adipose-derived stem cells clinically than anyone in the world. I also began traveling the world and working with practitioners and scientists to truly understand how we could use this technology. So about 3 or so years ago, I decided that it was time for me to go back to school and finish the PhD that I had not finished when I was in graduate school. And this was at Ohio State. And this was mostly because I had an opportunity to go to that startup called Osiris. So in no way do I regret leaving and not finishing the PhD at that time, because I had such an amazing opportunity to work with such a great group of scientists. So after traveling the world, working with many doctors and other scientists and learning so many things about regenerative medicine that you wouldn't necessarily learn in a traditional academic setting. These were more clinically based settings. I said, I better go back to school and finish that PhD. So fortunately, when I was at Ohio State, I had already completed all of my PhD coursework and defended what are called generals. So I really had about a year to go to complete that PhD. Now, when you transfer schools, oftentimes you have to repeat quite a bit of coursework, so I did do that. And then also you are somewhat limited for what you can research based on the existing personnel at that university and what projects they have grants for, et cetera. So at first I enrolled in Florida International University here in South Florida, which is a wonderful university, and they have some very nice programs. And I was in the engineering program there. So I completed some additional coursework and I published several papers using what are called bioreactors to condition stem cells for kind of future implantation. So I worked on some cartilage models as well as some cardiac models. But what I began to realize, even though I was enrolled in that program for a couple years, now keep in mind I'm also at the same time trying to work full-time, and I have 2 children and a husband. So you can imagine the rigorous schedule. And also traveling, speaking at conferences or meeting with physicians from around the world. I realized in short order that some of the projects that I was working on at FIU were really not in the space that I wanted to be, and that some of the things that I was working on were not something that had hit the traditional university setting yet. So I had an opportunity to transfer again and move to a university in Panama. Now, anyone who has followed the space will know that a lot of the stem cell treatments that have been done clinically to this date have been done outside of the United States. With regards to the regulatory framework, the United States has been somewhat behind in the regenerative medicine stem cell space. So patients have been traveling outside the country for 2 decades to get some of these stem cell treatments. So being able to work with a team in Panama that is familiar with the clinical settings and has been doing things more advanced than some of the clinics here in the United States for years was truly an honor. So I was able to publish a couple more papers working with that program, and I did in fact complete that PhD that I had been waiting for many years to complete. So I'm very proud of the work that is done with that school. And I bring this up mostly because it is something that I am sometimes criticized for, but I do not regret it at all. There are many ways to expand your brain and to learn about some of the different medical techniques that are going on, and to look just within your own country or the standard protocols would have been short-sighted for me. I learned so many things by traveling the world. So today we have several clinics here in South Florida, and we offer clinical treatments using stem cells and other regenerative medicine treatments for patients with a variety of different indications. I've seen things that you would say are not possible. Patients who are wheelchair bound, walking again. We've treated more than 10,000 patients with only a limited number of adverse events reported. Now, with anything new, when you bring something new into the medical space, it of course has to come with huge criticism before it is accepted as self-evident. I'll give you an example. When stents were first coming out as something that could be utilized for patients who are having a heart attack, famous cardiologists got on stage at some of the largest cardiac conferences and hugely criticized this technology and said that it would never work. Today, it's standard of care. So before things are accepted as self-evident, there has to be this criticism phase. So to kind of give you what's been happening lately, it was actually, it was Palm Sunday, so it was a week before Easter of this year, 2018, and I received notice from my attorneys that the FDA, on behalf of their lawyers, who is the Department of Justice of the United States, intended to file a lawsuit against me personally and against our businesses, stating that we should not be offering these treatments to patients. And these treatments are using the patient's own stem cells from their fat tissue and applying it immediately back to that same patient in a clinical setting. In other words, tissue out, isolate cells, tissue in. And that if I signed what was called a consent decree, and a consent decree which stated that we would immediately discontinue those protocols for the patients and essentially go away, they would not file this lawsuit. And the lawsuit also spoke of things like financial penalties and other penalties. And of course, the attorneys had to warn me of, at this point it was a civil suit, but that the possibility of turning it criminal, etc. And just to kind of give you a picture of what was happening that day, it was a Sunday, so I was home with my family, and I received the call from the lawyer, and I walked into the backyard because I didn't, I don't like the children to hear necessarily everything. They don't need that kind of fear in their life. It's hard enough to be a kid. And I collapsed into the yard, and I had kind of tears on my face, and my husband came running out, and he didn't know what it was, but he said this to me, he said, "It's okay. If we need to, we'll grab everything that can fit in the car and we'll just get out of here." And so I explained to him what was going on. And then I looked up at him and I kind of had tears in my eyes. And I said, "You know what I have to do." And he said, "I know what you have to do." And so we made the decision as a family, knowing that this would affect us, that I would not sign that consent decree, and that I would choose to stand up for the rights of Americans to use their own stem cells to heal. Americans should not be forced to leave the country to use their own stem cells. And that I have to have a voice for those patients that don't have a voice, and speak up as loudly as I can, because I have that strength. Now, I knew at that moment when I made that decision that I would be hugely criticized. I would be criticized for my experience, my background, for having an engineering degree versus a medical degree, for you name it. And I knew that the media would come after me. I knew that the media would come after my family. That's okay. I'm strong and I can fight this fight. And ultimately, the truth will prevail. And the truth is that we have stem cells inside our body that can assist in the healing process. So I wanted to, and before we kind of jump into some questions, one more thing that I wanted to kind of say, this concept of, look, stem cells from fat aren't the only way to do it. There's a lot of different ways that you could isolate stem cells. You could certainly do bone marrow cells. You can use things like platelet-rich plasma, and you could certainly use placenta-type products. But I think that this, again, is something that patients should have a right to choose, and they should be able to work with their practitioner to make these decisions and to have informed consent and to understand it. And if a patient chooses to use their own cells, that's something that you should be allowed to do here in the United States.
Thank you. I'm sure I'm not the only one that salutes you, and I'm sure you're going to find some unexpected allies along the way. There's an old expression that truth makes strange bedfellows. Mm-hmm. And sometimes your true friends and advocates come from places you wouldn't expect. And sometimes people you thought were your friends aren't, and that's part of the journey. Question, why did you choose fat cells for a clinical application of all? Does it have to do with therapeutic efficacy? Does it have to do with cost? Does it have to do with safety of procedure? I want my viewers and listeners to understand what's behind that choice.
Yep. So when you tap the bone marrow, this can be somewhat of a more painful procedure because you cannot anesthetize the bone. The other challenge with tapping the bone marrow is that it makes your body work very hard to replenish the bone marrow. When you take a small amount of fat tissue, we typically tend to have excess amounts of fat, and so it doesn't have kind of that same physiological response that you would have in a negative perspective from doing the bone marrow. Now, the other thing that was really important for me is that in the bone marrow, you have high amounts of white blood cells. And these are pro-inflammatory in nature, whereas the fat tissue does not have many white blood cells, but instead it has quite a bit of what are called parasites. And parasites are precursors to mesenchymal stem cells. So this is the reason that the number of stem cells obtained from the fat tissue is so much greater than that in bone marrow. So we have found that clinically we get better outcomes when we're using the fat tissue. Now, one of the reasons that we would choose fat over some of the tissue bank products, and this could kind of vary. Again, you have to leave yourself open to create a unique plan for each patient. There could be factors that would influence one way or the other. But with regards to tissue bank products, you're taking somebody else's tissue. Now, a lot of patients aren't going to want somebody else's tissue, so I personally do not want to utilize a tissue bank product. I would rather use my own cells. When we talk about doing an allo or a transfer of somebody else's tissue, we use tissue that has been disease screened. I think I'm certainly old enough, and many of your viewers are old enough to remember when we began screening for HIV. And every decade or so, we discover additional viruses, and that would be a concern of mine. I don't necessarily want to use somebody else's tissue, and I also worry about DNA integration from somebody else's tissue sample. Now, realizing that there could be factors where it's not realistic to do a mini lipo procedure or pull fat tissue off of a patient, and the tissue bank product is your best bet. So, again, kind of leaving yourself open to make those decisions on a patient-by-patient basis. And I think we have to move away from this traditional medical model of one size fits all. Everybody takes this one dose of pill, and if that gives you side effects, we have a pill for that.
Sure. I was just wondering what informed your choice about usually going that route. So I understand that.
Yeah.
So one concern I would have, not knowing anything about the actual procedure,
Mhm.
so it's probably a dumb question, but it's on my mind, is that fat, some of the worst toxins that humans have an affinity for fat cells, pesticides and
Yes.
heavy metals in particular. How do you deal with that reality when you're using fat cells for stem cells?
Yes, this is actually absolutely 100% correct. So this is one thing that people will sometimes, I can't seem to lose fat. You know, what's going on? All I eat is vegetables all day long. I said, well, you can get exposed to toxins from a lot of different places. It's not just from your diet. And just because you're eating vegetables doesn't mean that those vegetables aren't contaminated with glyphosate or other issues. So what happens is those toxins get stored in the adipocytes, which are the fat cells. So when we do the mini lipo procedure, we actually centrifuge or spin to remove the fat cells. So the fat cells are buoyant and they will float, and the stem cells are heavier, they're more dense, and they will go to the bottom. So we get rid of those fat cells and we only keep the stem cells. So all of those toxins are removed that are part of your fat cells. And and then
Right.
of course we're going to encourage our patients to detoxify. They've got to look at their life, and I think there's a lot of places that toxins can enter our system. So it's not just from a physiological standpoint, all of the
Sure.
toxins that we're exposed to in farming, but also from a mental standpoint. One easy trick that I often say to people is think about the 5 people in your life. Who are the 5 people that you spend the most amount of time with? And if these are not people that you admire, that you look up to, or that you want to be like in some way, or that you respect, you better change your 5 because you've got some serious mental toxins going.
Sure. So that handles that one. Um, one of the things that I think some people might have the wrong idea about is they have this idea when they think about stem cell injections, they think about site-specific injections for orthopedic challenges, like a shoulder that's not working right or a knee. And I want to give you a chance to talk about the non-site specific applications of stem cells, like for people with heart challenges and kidney challenges. And then the second part of that question is, do you find that the stem cells will naturally go where they're needed, or have you found added efficacy if you combine the stem cell injection with something that has a particular resonance and affinity for that particular organ?
Mm-hmm. Okay, so certainly for anything musculoskeletal, like your joints, shoulders, knees, etc., we will do what's called an intra-articular injection, because that will allow the cells to go right into the joint space and bathe any chondral lesions, defects in the cartilage, etc., or issues with, if you've got bone-on-bone rubbing and some inflammation, that can act in an anti-inflammatory way. When we're dealing with something that's more systemic, cardiac, lungs, kidney, by placing the cells into circulation, we allow the body to choose where it's needed most. And this is constantly going on inside your body. You're going to have an inflammation somewhere in your body, and then stem cells will rush to that area. So when we inject the cells intravenously and allow them to circulate, we actually don't get to pick where the cells go. The cells pick where the cells go. Your body picks where you need it the most. And I've seen this before, where a patient comes in, to meet with one of our practitioners, and they're thinking that they want to address, their kidney or, something along these lines. And they find that their ejection fraction of their heart improves. And it's the body who decided that there was a more immediate need, and it wasn't necessarily what the patient thought they needed to address. So really allowing the body to do what it does best. One of the criticisms that we sometimes hear is, well, if you just inject them IV, all those cells will end up in the lungs, and how could you possibly get any cells anywhere else? I actually think this is a really naive and inappropriate way to view it, because if that were true, we would all die after taking one breath, because our cells would circulate through the blood, our blood would take one pass, and everything would just stop in the lungs. And
Yeah, that's
then we'd all,
ridiculous.
die. So of course your cells are circulating, and it's constantly happening. You constantly have turnover. The other thing that I sometimes hear is when we're trying to address something that's neurological, we'll do this one of two ways. We can do what's called an intrathecal approach, which means that we inject into the cerebral spinal fluid in the lower portion of the back and allow the cells to easily cross the blood-brain barrier. But also by applying the cells IV, they're going to get into the brain. And so one of the criticisms that you sometimes hear from medical professionals is there's no way that cells you put IV would circulate into the brain. Well, again, I think this is a very naive way to view it, because what they're thinking of is there's no way that drugs that are placed IV would go into the brain, because you have something called a blood-brain barrier which protects the brain. But that barrier, of course, lets cells circulate into the brain, because if they didn't, our brains would deteriorate in a matter of an hour. So of course cells are circulating into the brain. Of course you have constant turnover of tissues. So we have to stop viewing stem cell therapy in the same way that we would view a pharmaceutical drug.
One of the things I love about this is that you're accessing the body's infinite intelligence, and rather than trying to play God. And, you know, one of the things that, you know, I've been in clinical practice for over 30 years. I've been studying healing and health for about 40 now. And one of my favorite things in all of holistic health is a subcategory of herbs called adaptogens. And adaptogenic herbs, by definition, take advantage of the same leverage that you're talking about. They're not designed, by definition, they're not designed to heal X or heal Y, but what they're designed to, or to push the body this way or force the body that way, but somehow they interact with this same natural intelligence to catalyze it, to wake it up so that the body will do what it would do if it was in tune with itself. And so this subcategory of herbs are extremely safe to give to people. There's virtually no known toxicity levels. You don't need to go to an expert herbalist because there are not a lot of contraindications. So it's not exclusive that way. And so in that sense, it's kind of populist in its spirit. And I think there's some similarities here where you're somehow catalyzing the body's innate healing intelligence rather than trying to play God.
Yeah, I mean, I think that the body is truly an amazing vessel, and we don't necessarily have to understand all of the intricate mechanisms of action. We should just, use that natural healing that's going on and see if we can dial it up a little bit in a natural way. I also think that the time is right and that patients are looking for alternative therapies. Our traditional medicine system has failed many patients, and a perfect example is the opiate epidemic. And I think that we're going to see more and more epidemics like that opiate epidemic with some of the other medications that are out there. And these are failing our Americans. Patients are feeling worse and worse. They're gaining more and more weight because they're exposed to so many different toxins. And the alternative medicine field is a perfect solution to help people achieve better health.
Now, are there any other doctors besides yourself that are putting it all on the line for standing for stem cell therapy in the United States, or are you all alone, or what's the current state of affairs?
Yeah, so within our clinics, we have several practitioners that continue to practice. So keep in mind that I'm not a practicing physician and or mid-level. I'm the scientist behind it, so I never actually inject or am involved with the actual patient treatment. But all of our physicians and mid-levels who continue to do these procedures every single day are putting their licenses, their livelihood all on the line. And I think that the reason that they do that is because they've seen the outcomes for their patients. So they're truly vested and interested in helping their patients to get better. They would not risk everything to continue to do this if they didn't see those results. At the same time, the FDA, on behalf of the Department of Justice, has also brought lawsuit against another group in California called the Cell Surgical Network, which is run by Doctors Berman and Lander. They too have chosen to stand up and did not sign the consent decree. In a lot of ways, they have been so important to me because, you know, when I'm feeling kind of down and out, I give them a call and they say, no, we're all in this together. And it's just nice, you know, sometimes you get caught up in like the competition of business, so that even though they're technically competitors to me, it's not like that. We're on the same side, and time will tell, you know, that history will show the truth, and that we will all prevail in the end, knowing that we stood up for something that was right. There's a third group that the FDA has issued a warning letter against, also in California, but there's no lawsuit at this point. It's at the warning letter level. So I'm not sure what will occur with that case and whether or not they will choose to stand up as well.
I'm wondering if the people that produced that 9-part series I mentioned earlier, I'm wondering if they would be interested in following your journey and showcasing it again, and maybe doing some more episodes. Have you been in contact with them, or have they been in contact with you at all? Do they know about you?
Yes, they do. And they've been very supportive. So I was just an invited speaker on that episode. I wasn't paid in any way, and I didn't pay them in any way, because
Right.
that was actually a criticism that I heard in the media, that like it was a thing that I paid for. I'm like, no, it wasn't. You know, I come here to speak the truth. And they have been very supportive, and, you know, just, and really that's what I need right now. You know, people just saying, hey, we're behind you, like, keep fighting. And they have, and then two of the people that were involved in that documentary have come out and filmed me again, to just kind of capture the story of the lawsuit, etc. So they created a little trailer discussing the lawsuit, and they're supposed to make that part of a bigger series that they're putting out, but I haven't heard the latest on it. But I do have the trailer, which is on my Facebook page, which anyone is welcome to go take a look at.
Well, you know, I'd like to sort of challenge you and challenge my viewers and listeners. When you said that what you're needing right now is the moral support, that's really what you need. Of course, you need that, but I think we can do much more than that to take an active role in being proactive in taking the conversation, the societal conversation that needs to happen, to a whole other level. You know, each of us has a mouth, and each of us can write. And I think it's the willingness to open up powerful conversations with powerful questions. You know, it's our bodies, it's our families, it's our world. And, you know, I just want to challenge you to be more open to receiving, not just moral support.
Yes.
Feel free to talk about the petition that people can sign. And, you know, everyone has their own sphere of influence. Think about the groups that you're a part of. Think about your family. Look for opportunities to ask opening questions, you know, like if you're with your girlfriend or something, or you're playing racquetball with your partner, you know, just say, hey, you know, I've been hearing about stem cell therapy lately. You know anything about it? Just to get the conversation going, because if you can get the conversation to the point where you ask what I think is the $1 million question, do you own your own fat cells? If you can get someone to focus for 10 seconds on the question, do you own your own fat cells, that can lead into some very, very powerful conversations that might not only be useful for stem cell therapy, but might actually make a big contribution to that person's awakening in general. So I think there's a lot that we can do.
Yeah, so you brought up the petition. There's a website called mycellsmychoice.org, cells, C-E-L-L-S, mycellsmychoice.org. So you can go there and put your name and email address in to sign the petition and just say that it's my body, it's my choice. And, we have to also be writing letters to the politicians in our area so that they know. I've been traveling quite a bit to DC and meeting with anyone who will meet with me. And a lot of times I'm only able to meet, with like the cleaning crew of the building, but that's okay. I don't mind. If my audience is one person, that's one more person who knows the situation. And I think that it is important that we continue to stand up for medical freedom.
One of the things that is interesting about what you're going through and the courage that the doctors need who believe in it, it reminds me of another movement that I'm very involved in, and that is the optimization movement that focuses a lot on hormonal optimization for men and women, bioidentical hormone optimization. And I don't want the show to be about that, but it turns out that, to make a long story short, the doctors that are committed to practicing hormonal optimization in the United States are putting their practice on the line. And so I'm already part of a group of, people that are very active in raising awareness about that whole field of hormonal optimization and doing what we can to raise awareness to support the doctors who are sticking their neck out in that area as well. And many of the socio-political economic forces you're dealing with are exactly the same ones they're dealing with. And so I think through our mutual connection with Jay Campbell, you might find some natural allies of physicians who maybe are not in the stem cell field, but they know what you're going through, and they are of like mind, and they have tribes. So that might be a high leverage line of thinking for you, where you already have a relationship established with Jay, where he has promised to help you. Again, I can't tell you how much courage those physicians have who are literally putting their practice on the line every time, or most of the time, that they're writing a prescription. And obviously, at some point, push is going to come to shove, and there will be some litigation, and it will force the conversation. And eventually, like you said, the truth of reality will prevail. But we're not meant to do this alone. And even with the incredible support of your amazing husband, it's an additional boost, I think, to be part of a professional collective of people that are
tears come to my eyes.
that are like-minded and like-hearted, but you can be beaten down so much, like a dog. You can be beaten down that you'll go for the bone, but maybe behind you is a 7-course meal, but you just have to turn around. And so I think there's a tremendous, I think you can access more support than you are. And I have compassion for you. I know, being a chiropractor for over 30 years, I know the prejudice. I know the glazed look in people's eyes when they ask me what I do.
Sure.
And I tell them I'm a chiropractor, and their eyes glaze over. I know what that feels like.
Right.
I know what it feels like when I'm having an intelligent conversation with someone, and they they're surprised.
Mm-hmm. Mm-hmm.
Yeah, I know what that kind of prejudice, I know that that's like a slow Chinese water torture thing that grates on you in more ways than you know. And I know how important it is when you're not properly understood, when you're maybe ahead of your time or you're a little out of phase with where the collective is. Or whenever you're going through any spiritual journey, the Buddhists talk about that when the going gets tough.
It's on my computer.
Yeah, there's three places you can take refuge. You can take refuge in the Buddha or the living teacher. You can take refuge in the Dharma, the lineage of the true teachings, and you can take refuge in the Sangha, which is the group of fellow travelers on the path. And I think we need all three. And I've tried it different ways, and it's a lot better with all three.
Yes, yes.
So,
yeah.
So it's interesting, the parallels, because...
So there was a physician who came to visit our clinic and was learning about stem cells with us. And he was one of the original physicians in kind of the bioidentical hormone. And they actually had put him in jail one time for prescribing some of the different hormones. And they had, I guess, told him he had to stop or something along those lines, but he said he would not because the patients were doing better. And that was the Hippocratic oath that he had signed. And they ended up actually putting him in jail. He said they put him in jail Friday, but then they said like it was closed or whatever, you couldn't get out. So he ended up spending the entire weekend in jail. But he stood up. He stood up for what he believed, and he believed that he had to help his patients. So he had kind of shared his story with me, and it's, gosh, it's really an honor to meet people like him. And you see so many parallels in history. For
did
those
he have
kind
to
of
leave
things.
the country to practice, or is he still
No,
practicing?
he's actually still practicing in California.
Okay.
Yeah.
Yeah. Yeah, definitely. Like I said, you meet people along the way you would have never otherwise met. So let's switch gears a little bit. Okay. Let's sort of spin a story here of, let's say, well, just to do two things at once. So one of my brother-in-laws has really bad kidneys, and he's in his mid-50s, and he's, for the last 6 months, he's been doing the 3 times a week dialysis thing. And I know from studying the statistics, I know that that's a one-way street. I know that that doesn't heal the kidneys, and I know after a while it's not enough, and people's lifespans are reduced and their quality of life sucks, and it's a huge moneymaker. And so I'm obviously wanting to help my brother-in-law. And so we found you, and he lives in Florida, and we're going to connect you guys. And so now we have to deal with the reality of that. So there's money involved, there's understanding involved, there's time involved. So let's just use him as an object lesson. Let's say he contacted your clinic in Weston and said what I just said about himself. So obviously he's under the care of some kind of nephrologist. And he's interested in seeing if he's a good candidate for you and if he can afford you and everything. Take me through what would happen.
Process. So typically when a patient will contact the clinic, we will schedule them for a consult with one of our medical personnel. So this would either be one of the physicians or one of the mid-levels, either a PA or a nurse practitioner, to go over kind of a basic medical history, what's going on and how the procedure would typically work. And how the procedure typically does work is it's an in-clinic procedure, which is outpatient. So you come in to the clinic and we do what's called a mini lipoaspirate, which means that we numb the area just below the skin using a lidocaine type mixture, and the patient remains awake during the whole procedure. So there's no general anesthesia, which is great because we don't have any of the risks associated with general anesthesia. And of course, many of these patients are very sick and general anesthesia would be out of the question. And after we isolate that small sample of fat, that typically takes about 30 to 60 minutes. And we process that using centrifuge to separate the population of interest, the population of cells, which we refer to as a stromal vascular fraction, and then apply those cells directly back to that same patient. So depending on what we're trying to address, we could either deliver it directly into the area, like for example, a knee joint, or apply the cells systemically. So for somebody like your brother-in-law who has a systemic issue, we would deliver those IV, and it's just a bolus push, meaning that we just push it into the vein and allow those cells to circulate. Now, the hope and goal would be that those cells circulate to where your body needs it the most. And in a patient that is more severe and has something that is degenerative, it's unrealistic to think that you would get one dose of stem cells and be completely better. So we often will recommend repeat dosing. And for a patient like that who's on dialysis 3 times a week, we would look at dosing every 4 to 6 weeks. Now, if the patient, after doing the consult, which could be done either via phone, Skype, or in person, decides that they're interested in moving forward, we then obtain a full medical history, look at all of their current medications to make sure that there's no contraindications, and also blood work. So we want to make sure that there's no surprises and that it would be safe and appropriate to move forward with the protocol, and all of that is decided by the medical professionals at the clinic. And typical price ranges are anywhere from, I would say, $6,000 to $12,000, depending on what you're having done. If you choose to bank some of your cells, banking of the cells is where we take an additional sample of that fat tissue so that you have future doses. So for example, in his case, he wouldn't necessarily have to redo that mini lipo procedure. He could just call doses from the bank. What's nice about that is for patients that are coming from out of town, those doses could be sent directly to the patient, so that if travel is an issue, many of the patients are wheelchair bound, or it's kind of cost prohibitive to continue to travel to Florida. Those doses could be sent so long as they have a practitioner in their area that's willing to work with us. One thing that is sometimes challenging is their current practitioner isn't familiar with what we do, or isn't necessarily supportive of what we do, and we can work through those issues as well. We're certainly willing to speak to any of those physicians to discuss the protocols and to see that if they feel it would be a good idea for their patient as well.
Why is the upfront cost? Most of the money's upfront. Why is that first visit so expensive?
Yep. So this is where we actually do that fat collection. So the mini lipoaspirate. So it is liposuction. So, in the same way that you might get a cosmetic procedure, we're just taking smaller amounts of fat. Now, originally, when these procedures were first being done, they were only being done outside the country. And those procedures were being offered for about $35,000 to $40,000. So by bringing this inside the United States and bringing it into kind of outpatient clinical setting, we've been able to reduce the costs quite a bit.
And how are people, like, a lot of people don't have $6,000 to $12,000 lying around who need this. Are there finance companies that will act as a financial middle person, or what are people crowdfunding? What are some of the ways that people that don't have that kind of money lying around are doing it?
So we do offer financing options, and of course, any sort of credit card, etc. And I have known many patients who are working on crowdfunding to pay for it. And that's certainly a viable option. My thought is that your most valuable possession is your health, and that you should spend every penny on making sure that your health is at its best, because when you're not healthy, you are not able to work, you are not able to provide, you're not able to help your family. So, you know, in the scheme of things, it's actually not that much money. And I think that when you consider some of the medications over time, you end up spending quite a bit of money on those as well.
Of course, but many of the medications are covered by insurance. So you're comparing different things. So let's get back to my brother-in-law. Let's say he goes, yeah, we'll do it, and somehow the money exists. So what I'm hearing you say is the first year or so he might get 6 to 8 injections.
Correct.
And then after that, maybe quarterly?
Yeah, I mean, a lot of this, yeah. So, I mean, every individual presents differently. So this is what's so great and unique about this, is that it allows us to look at the individual as opposed to the back label of a bottle saying, here's how you have to do it. We can look at the person. We can see, okay, what's happening? Where are your numbers? You know, what are we trying to address? And also, we don't have to limit it to one thing. So what if in a year from now, he says, hey, you know, my kidneys are doing great, but what about my knee? It's killing me. So once you have those cells banked, you now have an opportunity to use them for different things. So for me personally, I've had my cells banked for about 5 years, and I'll do regular doses, either IV or if I'm trying to address something specific like a knee joint. And I've actually spoken about this publicly, but I did do an injection of the cells into the anterior vaginal wall to help address some urinary incontinence.
So once you bank your fat cells, how many injections can you get out of that one banking?
It's typically 20 to 25 doses. Everybody grows a little differently. So I've had some patients that were able to get 40 to 45. I've had some patients that got less. So I have not necessarily been able to identify a trend. For example, if a patient's over a certain age, maybe they get less. One thing that we have been able to notice is that if a patient is a smoker or a heavy drinker, we do not get as good a quality or as many doses.
So if someone chooses to bank their cells and they're able to find someone who can responsibly do the IV push, then my understanding is every time they're requesting what they need to do an injection, that's about $500?
Correct. Yeah.
Right. And so that's assuming, that's not counting the cost of if they had to pay somebody to do the injection. But if they can find someone who can responsibly do it, that's what they're looking at least in today's economy.
Correct.
Okay. So even someone who's local to you could choose to go that route?
Yes, they could.
Right. Okay, so getting back to the object lesson of my brother-in-law, one question is, how do we know this is working? So obviously there are objective markers. You can redo blood tests, etc., which you or a nephrologist could do, but you're probably not going to do that every couple of weeks or something. Would the first thing that a person in my brother-in-law's situation tend to notice that he just felt like he would have more energy?
Yeah, that's certainly what we hear reported. And this really depends on what we're trying to address. So some are more obvious than others. Like in a patient who has lung disease, they might say, oh my gosh, I'm not having as much inflammation and coughing up and, you know, congestion. And I'm noticing I don't have to use the inhaler, something like that. Somebody who doesn't necessarily have something wrong might say, oh, I just noticed I have some more energy, or my nails or my hair grow a lot. And we believe that this has to do with the angiogenic nature of the cells. The cells can actually stimulate new blood vessels, new blood supply. So if you've got more blood circulating, you have more opportunity to heal and repair. In the case of orthopedics, these are sometimes more obvious faster because active inflammation may come down. So the source of pain kind of goes away.
Right. I remember in in that 9-part series, I was watching a lot of the stories were about orthopedic situations. And I remember people saying, you know, I did the injection, I really didn't feel much for 3 or 4 weeks. And then all of a sudden, boom. And then by the 8th or 12th week, I was thinking this is the greatest miracle in the world.
Yes. Yeah.
I'm just thinking about for someone in like my brother-in-law, what he might experience that would let him know that he was on the right track.
Yeah, I mean, I think the one thing that we hope for first is that the patients feel better. And that's the greatest measure. You know, when a patient calls and says, hey, you know what? I feel better. I was able to get out of bed and I was able to do the activities that I haven't been able to do. So that's certainly what we would hope for.
And I'm assuming that the nephrologist would be on the ball enough that he or she would adjust the dialysis schedule based on objective data.
Yeah, so we had a kidney patient not too long ago who then had to adjust the dialysis schedule. So that's definitely something that the nephrologist would have to look closely at. And you would want to make sure that your practitioner knew that you were doing some of these treatments and to keep a close eye.
Yeah, I would think so, even though there might be some patients that for some reason are afraid to tell their doctor that they're doing this. I would think in this kind of situation, that would be important.
I think so.
Given the legal challenges that you're dealing with, has it been difficult for you to find physicians that you feel comfortable hiring who are comfortable working with you? Or how did you find the physicians that you ended up finding?
So the physicians that work at our practice currently have been with us pretty much since the beginning. You know, it's in a lot of ways easy, I'll say, because once they do a few patients, seeing is believing. And especially for those cases, and usually this is how it starts, they'll start with their toughest case and say, you know, look, I've tried everything for this patient and really all hope is gone and they're just, you know, preparing for their funeral. So what do we have to lose here? May as well give it a go. And if they're able to convert some of those tough cases, that's when they can really become believers. And I think any new medical treatment comes to fruition in that kind of pathway. You try on those patients where everything else has failed. And so in a lot of ways, there's unrealistic expectations because we're trying only the toughest cases. And so once we kind of get past that, and once the physicians are more comfortable, they start addressing other cases, and then they see, you know, what works and what doesn't. And, you know, each physician makes their own decisions with regards to which patients they feel would be appropriate for the therapies versus not. They start to apply it to many different indications and applications.
Now, what is your role in the clinics? Are you the owner? Are you a part owner? Or how hands-on are you?
So I'm the chief science officer. My role historically has been assisting in developing some of the science behind it and also working on the publications. Day to day, I'm not so involved in the clinic. It falls to the practitioners and then the support staff who helps those practitioners. They make all the decisions clinically. And then I would say nowadays I spend a lot more time traveling and giving talks or, speaking to physicians throughout the world. And unfortunately, I spend a lot of my days with lawyers.
So basically the physicians who are there now are physicians that you trust. You don't need to oversee them.
Oh God, no.
No, these are people who they're functioning pretty autonomously.
Absolutely.
Right. And then do they select their support staff?
They do, yeah. So they have, right now we have some amazing people who work in the clinic, patient coordinators, et cetera, front desk help. And, our goal is, these are cash-based procedures. So it's very different than a traditional clinical setting, where you go into the doctor's office and you might only have 15 minutes with the practitioner. That's not how we want it to be. We want to truly listen. We want to get the full picture. You didn't get sick in 15 minutes. There's a lot more to this. And I think that's what's missing from medicine nowadays. So we have some really compassionate people who work in the offices to fully understand what's going on in a person's life.
That's great. You know, I know there are a lot of caring physicians that are considering getting out of medicine simply because they don't feel like they're helping people, or they feel that Big Brother is leaning on them too hard. If there are any physicians who are licensed in the United States, either medical doctors or osteopathic physicians who are resonating with what you're talking about and are curious about whether there might be openings in the future for your types of clinics or the clinics you mentioned in California, do you think that there is room for fruitful conversation with those physicians now, or
oh my gosh, 100%. So
better to
two
wait
things.
until the legal thing settles down a little? What would you suggest for physicians that are seeing this or hearing this and are getting really excited?
Yeah. So two things. We do have a physician training program where they can come through and learn about the different protocols and also learn about the field in general. So it's even if they don't intend to actively do it today, they still should be familiar with the space because it is the future of medicine. So that's called U.S. Stem Cell Training. We also have a conference that we run, which is called Academy of Regenerative Practices. The website for that is regenerativeacademy.com. And this is an annual conference where we bring together all of the top scientists and physicians from around the world to speak about some of the alternative programs to help patients regenerate. So it's not necessarily specific to stem cells, but regenerative medicine as a whole. And also, biohacking, tapping into our natural healing biology, and using modern technology to advance that. So I encourage physicians and other practitioners to attend that conference. It's a lot of fun. This year it's going to be in March, and it's here in Fort Lauderdale. It's a CME conference as well.
That reminds me, one thing I wanted to ask you about that I didn't, and that is, what is PRP? What is the relationship between PRP and stem cells? And what are the clinical indicators for one or the other or both?
So platelet-rich plasma is PRP, and this comes from the peripheral blood or just a simple blood draw. And from the blood, you have a lot of different components inside of it. And if you centrifuge the blood, you can begin to separate based on the density, some of those different components. So red blood cells are going to be the heaviest because they have iron associated with them, so they will go to the bottom of the tube. You then have what's called a buffy coat, and a buffy coat would include some of the white blood cells. And just above that, you would get your platelets and then the yellow serum above that. And so by centrifuging the blood and collecting populations of this spun out blood, you can change the concentration of the platelets. So that's how we come up with the term platelet-rich plasma. Now, platelets are the body's first responders. When you have an injury, so say you get a cut on your arm, the platelets will rush right to that cut and perform clotting. They will stop you from bleeding out, which is a very important thing, but it's actually minor in the scheme of what they will do. They're like the first responders, and then they start sending signals and commanding the rest of the cells into the area to hurry up and heal or make copies, or depending on the timing of it. So platelets are a very important part of this healing cascade. So by enriching the population from your blood, but then also combining it with some of the serum, which is going to be rich in growth factors and cytokines, all of which are part of this pro-healing cascade, you can apply that to, for example, orthopedics. That's probably the most common application of PRP. So PRP works very well in an acute setting. So if you just got a tear in your knee joint, you would want to apply platelet-rich plasma because it'll attach to some of the surface receptors of the stem cells that are going to the area. When you have something that's a little bit more chronic, like osteoarthritis, PRP may or may not be beneficial because it tends to be a stem cell poor environment. So what you could do is combine the PRP with a stem cell injection to really kind of enhance the effects. So you can think of PRP a little bit like fertilizer for your stem cells, which are the seed. You could also use PRP in cosmetic applications, so like fine lines on the face. I actually use PRP for a nasal spray. So if I ever get a little sinus irritation, you can spritz the PRP in the same way that you would use any other nasal spritzer, and it's anti-inflammatory. It can quiet down some of that inflammation that may occur, and it's a very natural way to address it as opposed to using like a steroid, like a Flonase type thing.
What are the laws in the United States about people's ownership of their own platelets and plasma?
So blood products are regulated a little differently, and platelet-rich plasma has kind of been in medical use for probably 10, 15, even 20 years at this point. A lot of it actually began in the dental space. So at this point, the FDA is not preventing practitioners from applying platelet-rich plasma, and many of the systems that are used to isolate platelet-rich plasma are called 510K approved. 510K is a little bit of a grandfathering in for devices. So because centrifuges predate some of the device regulations, which occurred in the late 70s, they can apply for a 510K and kind of get an exemption so that it can keep going. So it's not that any of those systems or the kits used to collect platelet-rich plasma went through a drug approval process or a device approval process. It's that they got grandfathered in.
Great. Well, I think many viewers and listeners probably before your explanation didn't know the ubiquitous benefits of platelets. They probably were thinking about it just in the context of surface wound healing. And it helps me as a clinician to understand why there might be a patient who has unexplained high platelet count. That it just means the body's trying to heal something, and if it's chronic, they're just not quite getting over the hump.
Yes, yes.
Yeah. Very interesting.
Sure.
As we begin winding down the conversation, there are a few things that are important for me at least, and one is to give you a chance to make sure we talk about anything else you want to talk about and to make any requests you want to make. And then the other thing is to make sure that the viewers and listeners, and we'll put it in the show notes and also, but for people that are more auditory, I want you to say slowly and clearly the different contact points for you and your work. And you mentioned some things for physicians. Go ahead and make sure that you mention all of those slowly and clearly. And then, like I said, anything else you want to talk about or any requests you want to make, the floor is yours.
Okay, fantastic. So first off, to get me, you can go to my Facebook page, which is an open Facebook page. It's Kristin with an I, Comella, C-O-M-E-L-L-A, PhD. And that's an open Facebook page, and I do use Facebook Messenger, and I do reply. So feel free to send me any kind of note that you would like, and I will reply to that. And I also have an Instagram page, although I've engaged the help of a millennial to help me learn how to use that Instagram. I'm much better at Facebook, but Kristin Comella on Instagram as well. And then the other thing is the clinic. You can visit the clinic page, which is usstemcellclinic.com. We do free consults, so you're welcome to send a note there or give a call over to the clinic and schedule a consult with one of the clinicians. Even if you just have questions about stem cells, we will chat with you about that. And then also I encourage you to go to mycells.mychoice.org to sign the petition. That's mycells, M-Y-C-E-L-L-S, mychoice, mychoice.org. And then finally, also to go to the Academy of Regenerative Practices. The website is regenerativeacademy.com. for any practitioners or really anyone who's interested in regenerative medicine to join us for our annual conference in March.
Let's go back to the petition. So if people sign the petition, what are they saying?
That it's their body, it's their cells, and they have a choice.
They should be able to choose what they want to do with their own cells.
Correct.
Pretty clear. I think it's a powerful message. I think that's the way to get people's attention.
Sure.
So is there anything else that you would like to make sure we talk about? Because I don't know what I don't know. So there may be some things I could have asked you that would have been really helpful, but it was just beyond my pay grade. Is there anything that you would like to make sure we talk about? And then do you have any requests that you want to make either of me or of the many viewers and listeners who over the next few weeks, months, and years will either find this video or find this audio?
I guess, just follow me on Facebook and listen to what happens next. This is an amazing journey, and I thank everyone for their support, and I'm here to answer any questions, so use me as a resource for anyone out there who just wants to know about stem cells. I'd love to chat with you.
Is there a particular U.S. attorney that is bringing your case forward that we could write letters of support for you to?
So I'm working with a firm in DC called Venable, amazing group of attorneys who have been so supportive and, really making, in my opinion, a great case for us. I think probably more important to write letters to your local politicians and just let them know that you disagree with the government trying to say that the cells in their body are a drug, and that you want to keep the right to use your own cells to heal, and you should not be forced to go outside the country to get these kind of therapies.
Now, do the laws vary state by state in the United States as of now, or is it more of a national deal?
So the kind of FDA laws are more federal. That's on a federal level. State by state varies depending on the medical boards. So physicians are regulated by their state medical boards, and those may vary. But with regards to stem cells, there's not a lot written. So that's one of the things that we found kind of challenging or confusing, is that there is no real law currently for talking about stem cells isolated from fat tissue at the point of care. So that's why we don't necessarily agree with the ability to file suit when there isn't a specific law for them to point to.
Yeah, the reason I asked that is I remember from watching that 9-part series that there was a lot of focus on progress that was being made in the state of Texas. And so I didn't know if that meant that people had to travel to Texas from some states where they couldn't, or whether it's not like that.
So some of the things that have been happening in Texas, and now many other states have followed suit, are right to try laws. And right to try laws, the way they're currently written, are written more for pharmaceuticals. So what a lot of these laws state is that so long as something is already in a drug approval process, meaning that there has been an investigational new drug filed for those products, that then those should be allowed to be tried by the patient. They have a right to try. Unfortunately, what we're talking about are clinical procedures. So there is no drug approval. So right to try, even though in theory the concept is correct that patients should have a right to try, we wouldn't qualify under those. So we're kind of in this gray zone of it's your own cells. This isn't something we can bottle and sell. Which is one of the reasons that pharma has been so hard to push against our movements.
Right. I mean, I would imagine that not only pharma would be pushing against you, but I can see that you might be stepping on the toes from their perception of some orthopedic surgeons.
Oh, yes.
Right. Right. Okay. So I'm just seeing if there's anything I want to say to complete things from my end. I would just say take really good care of yourself, take care of your family, be open to support from places you might not expect, and I really would encourage you to leverage your connection there with Jay Campbell, because he is connected to a lot of movers and shakers in the optimization movement that are just as committed as you are in their own field and just as fearless. And you guys have a lot of things in common. And I think your tribes could actually benefit from knowing more about each other as well.
Sure.
So I think there's a lot of synergy there, and I'll do everything I can in my power to help spread the word. And this is part of that. So
Awesome.
thank you for your courage, for your commitment, for the stand that you're taking. Yeah, it's just a balancing act between your mission and your health and your family, and it never ends.
Yes. Thank you so much for the opportunity and all the support.
Sure. So ladies and gentlemen, thank you so much. You've been listening or watching another edition of Freeing the Body, Freeing the Soul. I'm your host, Dr. David, the Cutting Edge Doc, and here on Freeing the Body, Freeing the Soul, we do in-depth interviews with individuals that are doing cutting edge work in the areas of healing, spirituality, and social transformation. My special guest today has been Dr. Kristin Comella, who is all about helping you and people like you to maintain control over your own body, your own cells, and to be able to use that control in ways that uplift yourself and those you care about. So with that, we'll close with love and peace. Bye for now.